Have you ever noticed that even though you think you're suffering from erectile dysfunction, you're still able to get an erection? Erectile dysfunction isn't always a serious condition to worry about. We often talk about how to deal with the situation. Taking medication full of side effects isn't always the best option, as it's only a temporary solution. So, what if we could find a permanent fix? Hi, I'm Dr. Marcos, and welcome to the You Stronger channel. Before we dive into today's topic, I want to invite you to comment below with the city you're watching from. But before we get started, don't forget to subscribe to the You Stronger channel and leave a like on this video. I need as many likes as possible to help reach and assist more people. Can I count on your support? To truly understand this concept, we need to first grasp how an erection works. One key molecule involved in erectile dysfunction is nitric oxide. Most medications for erectile dysfunction work through the nitric oxide pathway. So why is this important? What does nitric oxide do in our bodies? Well, nitric oxide helps relax the smooth muscles in our blood vessels, improving blood flow. Not only is this beneficial for erectile dysfunction, but it's also helpful for heart health and overall body function. Nitric oxide also helps produce testosterone and plays a role in the hormone that controls how much testosterone your body makes. Testosterone is vital for a healthy erection. Additionally, nitric oxide regulates cortisol levels, helping you sleep better. Stress is one of the common causes of erectile dysfunction. There are two systems working together in our body: the sympathetic nervous system and the parasympathetic nervous system. For a healthy erection, your parasympathetic system needs to be activated. However, when you're stressed, your sympathetic system takes over first. Now, we've talked about morning erections. When you sleep, your stress hormone levels are low, and your parasympathetic system is in control. So, if you're experiencing erectile dysfunction but still have normal morning erections, the problem might be stress. If you could reduce your stress, your erectile issues would likely improve automatically. Nitric oxide is also involved in your sleep cycles. A problem like sleep apnea increases the risk of erectile dysfunction. Patients with sleep apnea are more likely to experience erectile dysfunction due to the damage caused to endothelial cells in their blood vessels. These endothelial cells are the primary source of nitric oxide in your body. On the other hand, nitric oxide enhances sensitivity, which is crucial for managing diabetes. Also, keep in mind that some medications that lower cholesterol, such as statins and fibrates, can contribute to erectile dysfunction. So, nitric oxide is the key player here. If we can boost the nitric oxide levels in our bodies, it will significantly help resolve the problem. Typically, nitric oxide levels drop by 50% after the age of 40. So, is there any way to increase the nitric oxide levels in our bodies? The answer is yes. The first thing we need to do is practice breathing. Nitric oxide is produced in the sinuses and continuously released into the nasal veins. When we breathe through our nose, this nitric oxide reaches the tongue and circulates throughout the body. The next thing we should do is exercise. Exercise has numerous benefits. It helps reduce stress, which is very important for treating erectile dysfunction. It also improves your vascular system, endothelial cells, and increases nitric oxide secretion. So, exercise is key to a healthy erection. Now, let's talk about some foods that are high in nitric oxide. Spinach is not only a great addition to salads, but also a fantastic source of natural dietary nitrates. A cup of fresh spinach contains between 24 and 387 milligrams of nitrates. This amount can vary depending on conditions. In the pineapple family, bok choy is the highest in nitrates. Depending on conditions, bok choy can contain anywhere from 103 to 309 milligrams of nitrates per 100 grams. Next up is milk. While milk is not always known for its nutrient content, it actually contains a significant amount of nitrates. It contains 13 to 267 milligrams of nitrates per 100 grams of soup. Then, there are supplements. Supplements are rich in nitrates, which your body can convert into nitric oxide. According to a study, adults who consumed a supplement saw an increase in nitric oxide by 21% just 45 minutes after consumption. Next are beets. If you're looking for an alternative, beets contain 92 to 195 milligrams of nitrates per 100 grams. Other foods you can consider include garlic, meat, dark chocolate, citrus fruits, pomegranate, fruits, seeds, and honey. Now, the next thing to focus on is avoiding sugar, alcohol, and stress. Sugar increases the chances of having atherosclerotic plaques and can affect the endothelial lining of your blood vessels. The more damage to the endothelial lining, the lower the amount of nitric oxide in our bodies. Alcohol also reduces the levels of nitric oxide in our bodies. And as we discussed earlier, stress affects our body in many ways. Now, the next thing you should focus on is improving your sleep. A good night's sleep can reduce stress and improve erectile function. Also, one important point to remember is that many medications can cause temporary erectile problems. So, talk to your doctor if you're taking any medications and have noticed any recent changes in your erections. I hope this video has helped you. Share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. It will help this content reach more people around the world. Thank you so much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.